Welcome to ICU at the Heath Hospital. Today we're going to talk about the equipment around the bedside. We'll go through the different equipment that you will find so that you can familiarise yourself with the surroundings of ICU. We have the monitor, the IV pumps, the ventilator, the NG feed, the hemofilter, the ICP monitor, the LIDCO, and the Arctic Sun. First of all, we have the monitor. It shows all the usual observations that you would normally get on the ward. The red trace is from the arterial line, which gives us a continuous invasive blood pressure reading. At the bottom, you will see the white trace, which is the CO2 trace. It can give us an idea about the patient's ventilation. Importantly, if this trace is present, it shows the ET tube is in the airway and ventilating. Next, we have the IV pumps. These pumps are filled with syringes of medications. Commonly, they are infusing vasopressor, inotropes, sedation, and antibiotics. You can find the names of the infusions that they are on by looking at their bedside chart, which is filled in by the nurses. Now onto the ventilator. The purpose of this machine is to deliver oxygen and remove carbon dioxide. The common settings are SIMV. This stands for Synchronized Intermittent Mandatory Ventilation. This mode will ventilate the patient even if they are not spontaneously breathing. ASB is Assisted Spontaneous Breathing. The patient initiates every breath and the ventilator will provide pressure to augment the breath. And CPAP, Continuous Positive Airway Pressure. In this mode, again, the patient initiates every breath. However, the ventilator simply provides a single constant pressure. In contrast to the other two modes, in CPAP, this largely helps improve oxygenation over carbon dioxide removal. The NG feed looks like this on ICU. An NG tube is inserted after intubation to prevent the risk of aspiration. We try to feed our patients as soon as possible. Here you can see the rate at which the patient is being fed. This can be reduced or stopped if the patient is not absorbing and have high NG aspirations. Hemofiltration is a renal replacement therapy where the patient's blood is passed via this machine to a semi-permeable membrane where waste products and water are removed by convection. The replacement fluid is added and the blood is returned to the patient. This can be used in acute kidney injury, overdose of toxins, or as part of treatment for multi-organ failure. An ICP monitor, often called a bolt, is inserted through a patient's skull in order to measure the intracranial pressure. The most common indication is following a traumatic brain injury. An ICP over 20 mm of mercury is abnormal and must trigger immediate assessment and further management to avoid potential injury to the brain. Measuring cardiac output is important when caring for critically ill patients. LIDCO is one example of a cardiac output monitor, another being PICO. LIDCO stands for Lithium Chloride Dilutional Cardiac Output Monitor. It aims to actively measure cardiac output. LIDCO requires the patient to have an arterial and central line. It is used to guide therapy such as inotropes, vasopressors, and IV fluids. The Arctic Sun is an active cooling device. This is used to control the patient's temperature. Common clinical situation is following an out-of-hospital cardiac arrest or brain injury. This is a non-invasive ventilator, often referred to as NIV. As with the invasive ventilator, its purpose is to deliver oxygen and remove carbon dioxide. This is delivered through a tight-fitting mask. This device is high-flow nasal oxygen, often referred to as HFNO. It delivers up to 60 litres of humidified gas per minute, and the fraction of oxygen delivered can be adjusted between room air to 100%. Part of its mechanism is through the washing out of respiratory tract headspace. This means that carbon dioxide can be controlled to some extent, as well as oxygenation. Thank you for your time. I hope this video was useful.